According to NoSmoke.org, 33,800 people die every year from secondhand smoke. It is important for the public to know about the effects of smoking. Smoking is not only bad for your health, it is also bad for the people around you. I know many people who have quit smoking, and they are enjoying a much better life. Also, I've read the effects of what happens to someone who takes in secondhand smoke. First, I'll talk about secondhand smoke, then I'll talk about the effects that it has on someone, and finally, I'll talk about the benefits if you stop smoking. Secondhand smoke is inhaled voluntarily from tobacco being smoked by others. Between 70 and 90% of non-smokers in the American population, children and adults, are regularly exposed to secondhand smoke. Only 15% of the cigarette smoke gets inhaled by the smoker. The other 85% lingers in the air for everyone else to breathe. How is secondhand smoke exposure measured? According to cancer.gov, secondhand smoke exposure can be measured by testing indoor air for nicotine or other chemicals in tobacco smoke. Secondhand smoke can also be tested by measuring the level of cotinine in a non-smoker's blood, saliva, or urine. Now that I've talked about secondhand smoke, I'll talk about the effects of secondhand smoke. How does the smoke affect the person who isn't actually smoking? Well, the effects that secondhand smoke has on a person is horrible. Eye irritation, headache, cough, sore throat, dizziness, and nausea. Adults with asthma can experience a significant decline in lung function while exposed, while new cases of asthma may be induced in children whose parents smoke. Short-term exposure to tobacco smoke also has a measurable effect on the heart in non-smokers. Just 30 minutes of exposure is enough to reduce coronary blood flow. It increases the risk of lower respiratory tract infections, such as bronchitis, pneumonia, in children. Infants of parents who smoke are more likely to be admitted to hospital for bronchitis and pneumonia in the first year of their life. More than 17,000 children under the age of 5 are admitted to the hospital every year because of the effects of secondhand smoke. It also predisposes children to developing cancer as adults. Secondhand smoke may also affect children's mental development. A U.S. study found deficits in reading and reasoning skills among children, even at low levels of smoke exposure. The effects that smoking or secondhand smoke has on a woman who is pregnant is more likely to have a higher rate of miscarriages or stillbirths, have an increased risk of low birth weight infants, have a child born with decreased lung function, or have a child with a greater risk of sudden infant death syndrome, which is SIDS. Now that I have talked about the effects of secondhand smoke, I will talk about the benefits of quitting. According to the World Health Organization, about 15 billion cigarettes are sold daily, or 10 million every minute. According to the CDC, smoking can stain your teeth and cause bad breath, and negatively affects their athletic abilities. You can improve your sense of taste and smell. 12 hours after quitting, the carbon monoxide levels in your blood drops back to normal. 2 weeks to 3 months after quitting, your circulation improves and your lung function increases. 1 year after quitting, the excess risk of coronary heart disease is half that of continuing smokers. 5 years after quitting, the risk of cancer of the mouth, throat, esophagus, and bladder are cut in half. Cervical cancer risk falls to that of a non-smoker. Stroke risk can fall to that of a non-person after 2 to 5 years. 10 years after quitting, the risk of dying from lung cancer is about half that of a person who is still smoking. The risk of cancer of the larynx, which is your voice box, and pancreas decrease. Now I've told you about the benefits if you stop smoking. First, I talked about secondhand smoke. Second, I talked about the effects of secondhand smoke. And finally, I talked about the benefits if you stop smoking. Smoking is not only bad for your health, it's also bad for the people around you. And in conclusion, you need to think, who am I hurting when I smoke that cigarette? This is my visual aid. Quit smoking. Life is beautiful. Arsenic, lead, tar are just a few of more than 7,000 chemicals in tobacco smoke. 9 out of 10 smokers start before the age of 18, and 98% start smoking by the age of 26. Exposure to secondhand smoke causes 3,000 non-smoking Americans to die of lung cancer each year, and 33,000 die from coronary heart disease each year. This is a smoker's lung, and this is a non-smoker's lung. So this is a healthy person's heart and a smoker's heart. Have your last cigarette and lung cancer risk is half that of a non-smoker. Have your last cigarette and your risk of heart attack is already decreasing. Also, your sense of smell and taste are as sharp as a non-smoker's. You already feel more energetic and notice an improvement in your breathing. Your nerve endings are killed by cigarette toxins and begin to start growing back again. Your risk of heart disease is no more than that of a lifelong non-smoker. Your blood pressure and pulse should return to normal, and the level of oxygen in your blood should return to normal also. Your body's level of toxic carbon monoxide declines and returns to non-smoking levels after 36 hours. This is the most preventable death in this country. And you need to think, who am I hurting when I smoke that cigarette?